Dr. Izabella Wentz. Many of us at some point in our life have experienced issues with our digestion, and we might not necessarily think that something bigger could possibly be going on. And in your new book, Finding and Treating the Root Cause of IBS, you actually mentioned that a significant number of people are impacted by IBS. So how does someone know if they have the symptoms of irritable bowel syndrome, and what are some of the common red flags that we should know about?
So definitely if you have chronic digestive issues, if you have constipation, diarrhea, alternating constipation or diarrhea, these are going to be some signs that you might have IBS. So if it's been going on for more than a few weeks, then it's likely going to get the IBS label. Now, I do want to be very mindful that IBS is not like a very useful diagnosis because it's essentially a descriptive diagnosis that goes over the symptoms that you have. So a lot of times it's essentially like a patient-reported diagnosis. The conventional medical approach doesn't really do any lab tests or evaluations to find an IBS diagnosis. Rather, a person will come into a clinic. 12% of the primary care visits are based on digestive distress. And the doctor will say, oh, okay, so you've got these symptoms, then we're going to give you an IBS label. Now, here's the thing. There are a lot of different reasons why somebody might have these symptoms, including some red flag, really serious conditions like colorectal cancer, inflammatory bowel disease, that can be life-threatening. And so it's really important to note that if you have things like rectal bleeding, bleeding in your blood in your stools, weight loss, a digestive diagnosis that started after age 50, these are going to be some red flags that this is something that needs to be taken a lot more seriously, and you need to do more investigative work, potentially work with a gastroenterologist to have a colonoscopy and really get properly evaluated.
I feel like that's so important because so many times, even in my clinical practice, I see that not many people are actually taken seriously, that they get prescribed an over-the-counter pill or medication, and something more dangerous could be happening. And I think one of the biggest things that we have to do as clinicians and as healthcare providers is to make sure that our patients are safe. And I frequently see that patients are dismissed and are not given the proper evaluation or care, especially with colorectal cancer being on the rise and with younger population being impacted by it. Now, with your pharmacology training, how is typically IBS approached from a treatment perspective?
From the conventional medical approach, it could be, like you said, over-the-counter medications. So if you have diarrhea, you might get something like Imodium. If you have constipation, you might get some suppositories or laxative. And there's also some prescription options that can help with moving the bowels more quickly if that's what you need, or slowing down digestion if that's what you need. The challenge is, though, that less than 25% of people using the conventional medical approach actually have symptom resolution.
Wow.
Even years after their diagnosis.
And it's always surprising to me how you go to medical school and the best thing that you can prescribe is Imodium. Like, did we really go to medical school to prescribe that for our patients? You would think that we would have much better options, right? At least doing a more proper workup and just think outside of the box of what's just readily available at a local pharmacy store, right? What was your experience like? Because you personally have struggled with and recovered from IBS. What were some of your symptoms and what approach did you pursue?
Yeah, so I was actually diagnosed during pharmacy school, and it was not a very glamorous diagnosis, I'll tell you that. So my symptoms started on a night when I was studying for an exam, and I stayed up really, really late. I made myself a delicious ramen noodle cup with
Yum.
soy sauce. Like, I was like, this is like peak culinary, golden art. Like, this is amazing. It was so tasty. This was like what I survived on during grad school, right?
Like many grad students.
Like many grad students, I didn't know about proper nutrition, and I would just eat really convenient fast food. And my lifestyle was incredibly stressful. So I was in class 40 hours a week, and then I had exams twice a week at like 7:30 in the morning. So as you can imagine, I would just not sleep and I would rely on caffeine and fast food. And so one night I woke up in the middle of the night with like explosive diarrhea.
Mhm.
And I'm like, "Oh my god, I have an exam, but I can't get out of the bathroom, right? Like I'm just what am I going to do?" And so I called my school and they were like, "Okay, well you need a doctor's note because otherwise we're just going to give you an F for the exam and that's going to affect your GPA." And
Yeah.
I go to my primary care doctor who was this lovely older gentleman. I remember he said, "What's a girl like you doing at a place like this, right?" And he goes, "Yeah, you've got IBS. You're in pharmacy school. That's pretty stressful. So stress causes it." And he gave me a medication that is an anticholinergic medication to slow down my secretions. Now, unfortunately, the medication gave me like blurry vision.
Oh, no.
Yeah. So anticholinergic medications, we had this acronym. It was like salivation, lacrimation, urination, defecation, or no shit, no spit, right? And
Oh,
so
yeah.
it slowed down our gastric secretions, but also you got really dry eyes from it and kind of some brain fog. So I was like, well, this is not an option. And so I resolved to carrying like a shit kit with me every time I went anywhere. And it was like baby wipes, Imodium, an extra set of pants.
It's
Like it
like
was
you turned 90 overnight.
Yeah, it was very, like I had to live my life around it. Like it would pop up at the worst times, like I would be in lecture and I'd have to run out of class. I would go on a date and I would have to like excuse myself from the date.
Mm.
I would be at dinner with friends and it was just awful.
It's amazing the impact that our gut health can have on just on overall well-being. It's not just physical. Like you're bringing such a great example of the mental, emotional burden and how much of your life was revolving around that. And you almost have to, I feel like in conventional medicine, you have a choice. It's either, especially when it comes to like IBS and gut health, it's like you can live with diarrhea or you have the opposite, right? Where I know there's a better approach, and this is where your fantastic work and your book comes in. What is an alternative to that?
Well, figuring out why your gut is so upset, right? And so in my case, it was a combination of food sensitivities. And later I learned that I had some gut infections that were really making my digestive tract very unhappy. Looking at the research, Dr. Haba in 2011 studied over 300 people with IBS, with diarrhea, and he found that 98% of the time they had treatable causes. And so that means we figure out the cause and we treat it, and then all of a sudden the person's not symptomatic anymore. And
Yeah.
what I think is really fabulous is that IBS and gut issues are also correlated with like so many different conditions from anxiety to panic attacks to autoimmune conditions. And so oftentimes when you solve the IBS puzzle, the you can get help with so many other symptoms where I think I saw a meme one time where it said I had 99 problems, but healing my gut solved like 97 of them. And I feel like that's really true for a lot of people.
Absolutely. I'm in women's health and I help women with hormones all day long. And people usually find me for hormones and HRT and perimenopausal, postmenopausal care. And they're usually surprised at the total body approach that it requires. And if your gut is not functioning properly, HRT is not necessarily going to solve that, right? Unless we've got some thyroid issues that could be contributing to slow metabolism, slow gut motility, or hyper gut motility, then yes, getting that under control can help. But the gut plays such an important part. And I know both you and I have struggled with autoimmune conditions. And when I personally struggled with my hormone imbalance and autoimmune conditions, because I ended up with two postpartum, I started with the gut, but I knew to start with the gut because in my medical training in naturopathic schools, we talk about hormones, food sensitivities, and allergies, and the role that the gut plays in autoimmune development. So that's a really valuable point. And for our listeners, when patients live with a diagnosis, they live with it as if that is the root cause. Whereas, like you mentioned, that IBS, it's a label, but that's not the cause of the symptoms. There's usually other underlying conditions. Amazing. How long did it take you personally to recover from what was considered IBS?
So during pharmacy school, I found that a couple of things helped. So eliminating red meat and then soy helped me somewhat,
Mm-hmm.
but I would say like 50% helpful. And then once I really got my Hashimoto's diagnosis is when I began to take my health seriously. This was about 6 years after getting the IBS diagnosis. And interestingly, when I trained in functional medicine, which I feel like is very much based on the naturopathic approach, but it makes it more approachable to conventionally trained individuals, I learned that then IBS diagnosis can precede an autoimmune diagnosis by 5, 10, 15 years. And I was like, wow,
Amazing.
I think this is me. In between the IBS diagnosis and the Hashimoto's diagnosis, I started to have panic attacks, anxiety, hair loss, palpitations, carpal tunnel,
Wow.
just like acid reflux, all of these different symptoms. And I was in my 20s. I felt like my body was breaking itself apart. And at that point, I was like, I really need to do something about this. I think I'm a Leo, and the hair loss was just like, this is
Hair loss is
unacceptable.
big. Yeah.
Yeah. Being a a Leo in my 20s at that point, I was like, well, this I can't deal with this. I could have dealt with all the other symptoms, right? And when I got that Hashimoto's diagnosis, I was like, what can I do to get myself into remission? What can I do to be the healthiest version of myself? And why am I in my 20s getting this diagnosis that I thought like women in their 50s got, right?
Mm-hmm.
I didn't really have a lot of training on Hashimoto's during pharmacy school. I had a 1 hour long lecture that
Mm-hmm.
talked about thyroid disorders, and they covered both Graves' and Hashimoto's. And in my mind, it was just something that happened to you, kind of like menopause, right?
Right.
When you get older, your hormones just slow down. And really, it was at that point that I started to try to figure out what was causing my health imbalance. And I made that connection between my gut and my thyroid. And within 3 days of going on a gluten and dairy-free diet, a lot of my digestive symptoms and acid reflux and bloating went away. And I
Yeah.
was like, wow, I think this is something. These were the first two things that I did, but of course there was other things going on. I had H. pylori, and I had a another infection known as blastocystis hominis that was really
Mm-hmm.
wrecking my digestion. And so it was a process for me for sure. I would say from the initial diagnosis, it probably was about 10 years before I really got things into remission.
That's a really interesting thing because I know many of our patients and people listening to this, they've been struggling with something for a very long time. And it's important to know that it can take a while to get to the bottom of the symptoms. And everyone responds to different therapies and treatments. Like some people, yes, they have a sensitivity or an allergy to gluten, but for other people, it could be totally something else. Like I remember when I first opened up my clinical practice, I had a patient who had an allergy to carrots. That is not one of the things that that's on the top 10 of top allergens that I think of. But it's important to know that everyone just has a unique experience. And sometimes it can take a while to understand, is it the infection and getting the infection sort of fixed? Or, if we get rid of the infection, do we bounce back? Or is it the food sensitivities? And which one is the bigger player on our health journey? You said something, or you mentioned something fascinating. I believe you mentioned this in the book, or maybe from the other material that I've read online that you've published. On average, it can take about 4 years for someone to get an IBS diagnosis, which is a really long time. 4 years out of the life that we're living and struggling with these symptoms. And in women's health, like endometriosis, it can take an average around 7 years to get the appropriate diagnosis. What can clinicians do differently to help patients, and what can patients do to help advocate for themselves?
I would definitely, if you're a patient, I would keep a log of your symptoms. So perhaps like a stool log to
Mm-hmm.
keep track of that, and then present that objectively to your clinicians. I would consider going to somebody that is a gastroenterologist to get a proper diagnosis and to get some of these things ruled out. Up to 25% of people who have an IBS diagnosis might actually have celiac disease. And so
Yeah.
you definitely want to get tested for that because, I mean, probiotics and stress reduction probably not going to help you that much if you're still eating gluten and you have celiac disease. And
Mm-hmm.
really considering working maybe with somebody that's trained in functional medicine or naturopathic, that can help you figure things out as well. As far as clinicians go, I feel like really my goal would be for them to think outside of the box and really, if they see a person struggling with digestive symptoms, to consider what might be going on, what might be happening underneath all of that. Like, what is driving their digestive symptoms? Digestive symptoms, yes, are very common, but they're not exactly normal. And so if somebody has had IBS like symptoms for quite some time, sure, you could provide the IBS diagnosis, but knowing that it isn't, it's kind of like the first label, it's not the cause. So I really encourage clinicians to do a little bit more investigative work. So potentially doing some more lab testing, figuring out maybe a gastroenterology referral. I really am a big proponent of comprehensive stool analysis testing, SIBO testing, organic acid testing, um, elimination diet, food sensitivity testing to really figure out what's going on within a person.
Absolutely. And in conventional medicine, when a patient requests even a stool test, it can be pretty limiting because they're usually looking for like Giardia or E. coli or some of more common parasites. But it's important to do a more in-depth gut test, stool test that can look at inflammation markers, that can look at gut permeability markers, as well as yeast overgrowth, potentially some of the less common parasites that we're exposed to. So that's one of the reasons it's so important to work with someone who's trained in this field and can look a few layers deeper.
It's very tricky because a lot of times conventional medical doctors have their panel of labs that they might do. So, for example, they might do an ova and parasites test for somebody
Right.
or look for Giardia, right? And Giardia can absolutely be an important cause of irritable bowel
Mm.
syndrome, but there are other causes too. So, up to 72% of people might have blastocystis
Mm-hmm.
hominis. And this is like a really controversial protozoa. But so many studies have shown that it is implicated in IBS, chronic urticaria, and even Hashimoto's. And eradicating it can help with symptom resolution for a lot of people. And that one is oftentimes not going to be discovered on that type of testing. And then there are things like fecal elastase, for example. This
Mm-hmm.
could be a marker of pancreatic insufficiency or poor fat digestion.
Mm.
And this is a common cause of IBS symptoms as well. Now, there is a little bit more awareness about exocrine pancreatic insufficiency as a potential driver of digestive symptoms, but I feel like it's still limited in the conventional medical world, where if somebody were to do a test like the GI map or the gut zoomer, they'd be able to see some of these abnormal markers and help that person accordingly. Again, it's tricky because many conventional doctors might not have an account with
Right.
those particular lab test
Yeah.
providers. I'm a big proponent of working with somebody who is well versed in that. And also, there's a platform called Rupa where patients can self order their own labs, which I love because that puts the power back in the patient's hands.
Yeah. And a lot of patients and people who are listening to this, they are so much more educated around these topics nowadays that I feel like when they go in to see their usual healthcare provider, they don't really have many answers for them, right? They have a lot of questions and not a lot of answers. But there's a beauty in the referral to have a network of physicians that you can rely on who are trained and have a certain skill set on this topic and other topics in functional medicine. In your work and in your research, I know that whenever I do a deep dive on any particular topic, I usually come across things that are unexpected or that are surprising to me that maybe I didn't learn in medical school or some of the other trainings that we go to for our continuing education. Is there anything that you came across that was surprising to you?
Bile acid malabsorption. So, this
Mm.
was a topic that I was definitely not trained in during pharmacy school. And this is a cause of diarrhea, like a really important cause of diarrhea. And taking the medication metformin can actually cause it. And I feel like
Wow.
that was a big miss for me as a pharmacist, that
Mm-hmm.
a person can have this significant. I mean, I knew that a lot of medications can have side effects, but I
Right.
just I didn't really know how serious a side effect of metformin could be.
Yeah. And a lot of people are on metformin nowadays. Whether
Yeah.
it's used before starting a GLP-1, then there's some longevity studies that support the use of metformin. Sometimes we use it in addition to a GLP-1. And of course, one of the symptoms is diarrhea or loose bowel movements. So I find that even cutting back on the dose or taking holidays with metformin and including digestive enzymes can help. Is there anything that you recommend people do who are on metformin or saying, check, 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 this is me?
Well, definitely all the things that you mentioned, but also there are alternative options depending on what you're looking to do. So, if you're looking potentially berberine might be an option for some people, or considering medications that might have a gentler
Mm,
impact on your profile. The other thing that I also learned that I didn't learn during pharmacy school was the medication Yasmin, a
mm,
drospirenone containing oral contraceptive, that's been implicated in irritable bowel syndrome.
interesting.
Specifically, that can cause a lot of gut distress and intestinal permeability and a lot of damage to the intestines. And so, women who are put on this type of birth control, I know, I'm sure, may, I don't know if many people know this, I'm sure you know this, but it was kind of a drug of choice for a
Right.
while because it helped with weight loss.
Mhm.
Drospirenone is a bit of a diuretic. And so, whereas other birth control pills made people a little bit puffy, this one helped with weight loss. So, it was very, very popular with many young women. And I oftentimes wonder if there was a trend with hot girls having IBS. Is like how many of these women were put on birth control pills and then developed IBS as a result of that?
Gosh, well, there's so many other issues that go along with that form of birth control.
Absolutely.
It's there's so many other ways that we can lose weight and be optimal for sure, but I could see why women would prefer that between hair loss or improving hair growth and weight loss. Those are two pretty hot topics in women's health. And I know sometimes women are desperate for a solution. And part of it is nowadays we're just having so many more of these conversations. What are the safer ways to lose weight? What are the safer ways to grow hair without all the negative side effects or other ways that could hurt our health potentially down the road? I know that, speaking of oral contraceptives, and this is sort of a great segue into another question that I had for you. There's a lot of stigma around pharmaceutical medications, but they're not all created equal, and some may actually be really beneficial. Like there are times when I've seen rifaximin or Xifaxan work extremely well, and it can actually help solve the underlying issue that we're struggling with. Are there certain pharmaceutical agents or medications or prescription medications that you actually find work really well and are welcomed in the IBS protocol?
So definitely depending on what symptom no, so definitely depending on the root cause. If somebody has SIBO, for example, rifaximin can be incredibly helpful and work potentially faster and better than utilizing herbs. And I would say
Mhm.
the same goes if somebody has a parasitic infection. Many times the parasitic protocols that are herbal in nature can take like 60 to 90 days, and some of them can upregulate liver enzymes. And it
Mm.
takes a really long time to feel better with them. Whereas there's a medication called Elenia that
Mm.
can get rid of a parasitic infection in like 3 days.
Yeah.
And that's generally well tolerated. I will say I have seen some people develop a thiamine deficiency
Mm.
and some B vitamin deficiencies. So I'm a big proponent of if you're going to take that medication or any medication in general, you
Right.
want to look up the profile of what kind of nutrients it might deplete. And
Yeah.
that can help you have a safer effect with utilizing the medication. So you get the most benefits without some of the side effects and drawbacks.
That's a really excellent point, and that information is readily available. I mean, this is something that any patient can pull up their current list of medications that they're on and see what potential nutrient deficiencies they may have. And nowadays, even the primary care physician can order even a serum panel for some of the common nutrient deficiencies that people can struggle with, including B vitamins. And I know Vibrant Wellness has an incredible nutrient panel, everything from the common nutrients that are available in a multivitamin to amino acids that people are easily low on nowadays. But that's a really great point. And when we do that in-depth testing, then we can customize the plan even more. I've seen quite a few of my patients who are trying to get their B12 or folate levels up, and a lot of those supplements can come with vitamin B6. And then they end up overdoing it with B6. But we wouldn't really know that unless we test it or they're starting to show some symptoms that they're having too much B6 in their system. Is Alinea, is that part of the pharmacological training that you received, or is that something that you stumbled upon yourself?
So it wasn't available, I don't believe, when I was in pharmacy school. So I was trained more in like metronidazole and Flagyl as a medication that would be used for those kinds of conditions. And that medication can be effective for some protozoal infections and gram-negative infections. But the tricky thing is that many of them have developed resistance, and the medication can be poorly tolerated. One of the things it's notorious for is if you have any alcohol with it, you can have a really serious adverse reaction. Not that I'm advocating having alcohol, but it's kind of fell in out of favor because it can cause a lot of side effects.
Right. Yeah. Well, that's a really important thing to know because, again, not that we're encouraging people to have alcohol by any means, but people drink alcohol. So it's really important to consider. And I've done so many gut tests on patients, and it's amazing when we put them through a different protocol depending on what the underlying infection is, for example, how much better overall they feel. What are your favorite protocols in terms of even eradicating certain parasites that we're exposed to on a day-to-day basis? And does everyone need a parasite cleanse? Because I feel like whenever we open up TikTok or Instagram, it's like everything is related to parasites. Every symptom is related to parasites. So what are your thoughts on that?
So definitely, I think there are great broad spectrum protocols for parasites and some of these cleanses and whatnot. They can be, I'm not against them. I feel like they can be helpful, but they're only going to be as helpful as the parasites that they cover. And my discomfort with them is that I've seen many people going through them and they're still symptomatic, and they've just spent like thousands of dollars and years out of their life just doing these different parasite protocols. Whereas we would do a test on them and we would find like parasites.
Yeah.
And it's like this protocol, this is a great herb, but looking at the research, this doesn't actually cover this particular bug, right?
Definitely.
And so my training is this bug gets this drug, right? And we can translate that into herbal medicine as well.
Yeah.
For example, for Blastocystis hominis, it's a tiny, tiny protozoal parasite. One of the things...
Tiny but mighty.
Tiny but mighty. One of the things it does is it depletes our secretory IgA levels. And so what I've seen in my experience with many people is looking at their comprehensive gut tests where they'll have multiple parasites, right? And all of them need something different to treat them. And I'll also see like, hey, their secretory IgA is really, really low.
Yeah.
And so the most important thing to do in that particular person might be to raise their secretory IgA levels, because the secretory IgA is like our first line of gut defense and can help us fight infections naturally. So I might utilize something like Saccharomyces boulardii with that particular person to raise the secretory IgA levels. I will say I do use megadoses of that. So typically the label might state to utilize like 1 per day, depending on the colony forming units. And I might use like 8 of those a day. Spaced out a few times a day. So going back to Blasto, I also like to utilize berberine and oil of oregano for a 60-day course for that. Sometimes lipase containing digestive enzymes to break apart the lipid surrounding shell that encapsulates the blasto, because it can go through different variations and different life stages. Some of the life stages, it lives in this lipid shell that makes it in it penetrable to medications and herbs.
It's like a knight in shining armor.
Yeah, it gets this shield. And so the lipase can potentially help with like breaking down that fat layer around it. And then I really like sometimes I have used artemisia and wormwood, but I don't like for people to use that on their own just because it can impact liver enzymes. So I'm a big advocate of testing liver enzymes before, during, and after utilizing that herbal remedy. And yeah, I definitely like to use a variety of things depending on the type of infection a person has.
Yeah. Testing first. Test, don't guess, right? It's just like with hormones and in women's health. I always say, like, we want to know what we're dealing with before we put someone on a certain protocol. It's good to know those things so that we can have the most impact depending on the therapies that we choose. And I have seen liver enzymes go up in patients with certain protocols. And that's something to note, that it's important to also test the liver enzymes, because that can also impact the protocol that we choose, something that's a little bit more gentle and doesn't affect our liver negatively, for sure. One of the things that I know, your husband has struggled with IBD, and I know that he is very fortunate to have you in his corner. And it's always different when someone we love, someone close to us, is struggling with any sort of health condition. We're, as healthcare providers, we're used to taking care of other people. We're used to publishing work and protocols to help others, but it always hits differently when it's someone close to us. What was his journey like, and how do people know if it's IBS or IBD?
It was definitely a tough journey. So it happened that I was going into labor with our son, and he said, I've had some bleeding with my stools. And I was like, I'm like literally in labor on the way to the hospital. So I was just like, sympathy pains, hemorrhoids, whatever, like I wasn't focused on what was going on with him. And one of our friends who's a physician was like, oh, maybe he's just been doing some weightlifting. Like my husband, when I was like super pregnant, he's like, I'm going to rebuild the garage and do weightlifting. Like typical husbands just... I know your husband took like a hiking trip when you were like super pregnant, right?
That's right. Yeah. My husband, I was a few months from going into labor, maybe a couple of months, and he is an ice climber. So he used to do a lot of alpine climbing. And I remember he decided to do like one of the hardest routes in the Pacific Northwest. Very few people have actually attempted and successfully climbed that mountain. And I remember thinking to myself, really? Really? Now is a good time to do this?
Yeah. So for same here, the timing wasn't ideal, right? And so we're like, okay, whatever. It's like sympathy pains, whatever. And then, so we have the baby, and then his symptoms don't get better. And also he's kind of like very shook up, and also waking up at like 12 in the afternoon saying how tired he is. And I'm like,
wow,
I was up with like this baby like for 72 hours straight, and like, you're tired. Huh. How is that happening, right? And so we were like, he had been like an ultra marathon runner, like would wake up at 5 a.m. bright-eyed and bushy-tailed. So we're like, something is off about you. And I don't think it's like stress. Like, I don't think it's just like you had a new baby and, you worked out a little too hard. And so our primary care physician referred him for a colonoscopy. And that's when he got the ulcerative colitis diagnosis. It was actually like our son was 2 weeks old and my mom was at home with him. And Michael and I were, at the gastroenterologist's office. I was very fortunate. We were both very fortunate because we had 3 really close friends who specialize in inflammatory bowel disease in Boulder. And I had just gone through the IFM gut module when I was pregnant. And so we developed a plan for him to get him into remission really quickly. He was able to get into remission within 6 to 8 weeks and had a couple of flare-ups as we kind of dialed things in. But he's been in remission from IBD for the last 7 years. Wow. And the same protocol that I co-developed with my friends, we were able to help other people with IBD with it as well, to try to get them to get them into remission very quickly, even when other things didn't work for them. So people that had been struggling for decades, the protocol can really help. And it's my friend Debbie Steinbach, she's a nutritionist. One of her approaches is like a mushy diet. You can use the elemental diet or a partial elemental diet for 3 days to a few weeks to really resolve that inflammation in the gut. My friend Steve Wright recommended high-dose turmeric. That can be a game changer. Serum-based immunoglobulin can be a really big game changer. And
Right.
boswellia frankincense. So a lot of these like anti-inflammatories can really help soothe the gut and soothe the inflammation.
Yeah.
And then you would want to do a comprehensive workup analysis, I would do a drug review, a review of their diet to see if there were any things that were contributing, a gut test. The tricky thing with IBD is a lot of times the gut protocols. So the beautiful berberine oil of oregano or high-dose probiotics, people with IBD might not be able to
Yes.
actually tolerate them, especially in the beginning. And so
Yeah.
you want to be very mindful of how you treat them because you've got to be really gentle with their system for the first, I would say, 3 to 6 months of getting them into remission. And then you can do a little bit of deeper work. So because IBD oftentimes gets misdiagnosed as IBS, I would say probably like 10% of the time looking at the different research.
Mm,
I have a whole chapter on if the cause of IBS is actually IBD, what do
yeah.
you do about that, right?
Yeah. Do you ever see success with lorazepam, which is an amazing peptide for gut health? And I know there's quite a bit of research in terms of celiac disease and Crohn's and using lorazepam to prevent leaky gut and treat leaky gut and reverse some of the IBD conditions that people may be struggling with. Have you seen any success in using lorazepam?
I've seen it a lot in IBS and also in food sensitivities that it could be really, really helpful for those conditions.
Mhm.
For IBD, I really like low-dose naltrexone as well, but I
Yeah.
haven't done too much research on using lorazepam. I just found out a couple of years ago that we can get it. So I was following the research for
Hmm.
quite some time, and I was like, oh, I hope this comes out as a drug soon.
Yeah.
And then just in the last few years, I went to a conference where I found out we can get it from a compounding pharmacy. So I
Yeah.
feel like that's super, super exciting. That whole class of peptides and treatment protocols are becoming available.
Yeah, absolutely. Our toolbox is slowly but surely getting diversified, and we have so many ways that we can actually improve gut health and overall health, because when we improve gut, everything seems to improve as well. It's sort of from our mood to how we think to how we live our lives. It is such a huge impact. What are some of your absolute must-haves when it comes to any IBS protocol? Like if it would be your top 3 or top 5 or however many it is that most people who are on this journey, if they're in the early stages of figuring out if they have IBS or IBD, or even some of the veterans who've been on this journey, for you it was like a 10-year path, and for some people it's, 4 years or whatever that number is. What would you say are the top things that any IBS protocol should have?
So, definitely a comprehensive workup. Like, if you're a person that's really new to this and you haven't really changed your diet, that might be the first place to start. So, doing an elimination diet might be incredibly helpful. Gluten and
Yeah,
dairy are some of the common reactive foods. In IBS, also like raw and fibrous vegetables can be a problem.
right.
Lettuce can be a problem. Blueberries can be a problem.
Mhm.
There are some people that react to fatty foods. So, figuring out your individual food triggers is really, really important. A low processed diet and low additive diet.
Like the
Fruit,
mushy.
yeah, that, but also like there's food additives,
That's right.
and there are also those artificial sweeteners or non-caloric sweeteners that can act as osmotic laxatives.
Yeah.
My husband in particular had an issue with erythritol, which is added to many keto
Like
foods.
monk fruit is usually paired with it.
Yeah, monk
Yeah.
fruit I would say is a little bit better tolerated, but
Mhm.
erythritol is notorious. It can cause a lot of gut inflammation.
Yeah.
Guar gum, a lot of these food additives that are found in processed foods are going to be really, really problematic for a lot of digestive issues. I know Haribo, the company that makes gummy bears, replaced the sugar with like a non-caloric sweetener many years ago,
Yeah.
and a lot of people had too many of the gummy bears and ended up having like explosive diarrhea.
Gummy bear induced diarrhea.
Yeah, yeah. And so just really being mindful of the processed foods that you're eating can make a really big difference for a lot of people with IBS and IBD. Like you don't
Yeah.
necessarily need to even eat organic everything, but just home cooked. without all these additives can make a really big difference. And this is such an amazing place to start. Another thing to consider would be really thinking about your digestion. And digestion starts in the brain. And so we want to make sure that we are in like a calm state of mind and calm environment when we eat our food. I know I'm a mom, you're a mom, and I know there were many times where I would be like just chasing around my toddler and eating whatever leftovers there were, and that's not the way to do it. So you want to be mindful. You want to chew your food properly and really get into that parasympathetic rest and digest when you're trying to eat. Digestive enzymes can be really, really helpful for many people. I love like broad spectrum enzymes that just really kind of do the whole gamut. So they'll help with like vegetable digestion. They'll help with a little bit with protein and fat digestion. This can be a great place for many people to start. Utilizing things like herbal bitters can be helpful if you're struggling with your digestion. I really love utilizing these as like a starting point. Now, I know that you and I have some clients, patients that eat better than we do. And
it's a constant reminder for me.
I'm very grateful for their, they just live such a beautiful and clean lifestyle, and they eat so well, and they're organic, and I'm like, they just put me to shame, right?
I listen to my patients, I'm like, that is a good idea. Noted.
Yeah, but they're still struggling, right?
Right. Yeah.
And they're still struggling with symptoms. And for those individuals who have been on this journey for quite some time, I would say like, let's do some comprehensive testing.
Right.
Let's figure out what's driving the symptoms. I've had like nutritionists that I'm just like, wow, like you are amazing and so brilliant. But we would do a stool test, and then we would find that they had like really severe infections. And then guess what? Clearing the infection can help get rid of symptoms, or low fecal elastase. And that can actually, just doing some pancreatic enzymes and ox bile. This can be like the magic bullet. Or maybe you had elevated calprotectin, which is an indication of inflammation, can be an indication of inflammatory bowel. And so we would put them on an anti-inflammatory protocol.
Yeah.
And that can make a really big difference versus being like, I'm just going to eat my fermented vegetables, amazing, right? Or my yogurt, amazing, like works so well for so many people, and eating clean.
Yeah.
But if you've been doing that for a while, like there is a whole bunch of triggers that I talk about in this book. There's like 20 plus different reasons for IBS symptoms. And if you figure out the exact reason, then you can get on the right protocol, because every reason has a different protocol. If you have SIBO, you're going to need to do something different than if you have SIFO, than if you have protozoa, than if you have low pancreatic elastase. And sometimes you need to do a whole bunch of things at once, because one person might have like an H. pylori infection, and that's suppressing their stomach acid, and that means they're going to have SIBO ongoing because their body is not deactivating the bacteria, and they just end up getting into their gut. So it's a whole thing sometimes that we need to do with like more complex individuals, right, that have already cleared their diet. I was like, oh, everybody just needs to go gluten-free when I first started because that's what worked for me. And then, as you, I'm sure, have been humbled. I was very humbled by my clients and patients, where I was like, oh, yeah, you're already gluten-free and you're still having symptoms. And I had to really do some more digging. And SIBO is one of those things that everybody says causes IBS. And yes, in some people, it can be the root cause, but in other people, it might be like an incidental finding or something that's downstream or upstream of the primary root cause, or they might not even have SIBO at all, right? And so we need to kind of dial that in.
Yeah, absolutely. Well, and you mentioned something about mindfulness, and it's amazing for how many women probably just even like slowing down and chewing their food can have a significant impact on their digestion. I had a patient, and we had a hard time nailing down what was affecting her digestion. We've done the gut testing, we've done food sensitivity testing. I've done so many different protocols under the sun, and most of them would move the needle for the patient, but then we would kind of be back at square one at some point. And I remember asking a really simple question, which was, do you drink a lot of water with your meals? And she goes, well, yeah, I can drink like 3 glasses of water while I'm enjoying my dinner. And that in itself can dilute enzymes and can impact nutrient absorption and impact gut motility. So even just cutting back on the amount of fluids pre-meal and post-meal. Of course, if you need a sip of water during a meal, please don't choke, right? Drink the water or whatever you're drinking. But that intervention, as simple and almost common sense as it is, really helped cut back on her bloating and improve her digestion.
Yeah, absolutely. And I love also using like hot lemon water
Yeah.
or a little bit of apple cider vinegar for some people that can make a big difference. And for some people, it's just like chewing slower.
Right.
And chewing your food more can make a really, really big difference.
When I first met my husband many years ago, he was surprised at how long it would take me to eat my dinner. Like I could eat my dinner for 3 hours. And then when my son was born, I could finish my food in like 5 minutes. I would literally inhale it because just like, it's like just running around and trying to catch up on life and food. Before I'll get into just some rapid fire questions, where can people follow you? And is there anything that you wanted to mention that we didn't cover?
So thyroidpharmacist.com is my website. And if they wanted to get the book, they can go to thyroidpharmacist.com/IBS. I'm also active on Instagram, Facebook, YouTube, TikTok, and I have a podcast called Thyroid Pharmacist Healing Conversations.
Mm-hmm.
I love educating people. I love sharing things that they could do to take charge of their own health. My book is available on Amazon and Barnes & Noble, wherever fine books are sold. So it is Finding and Treating the Root Cause of Irritable Bowel Syndrome.
Mm-hmm.
And the one thing that I wanted to mention is with colorectal cancer, that being on the rise, this is something that I'm a big advocate for people getting screening preventative colonoscopies to see if, you're at risk. And also doing a comprehensive stool test, because a lot of the things that we talked about in this podcast, for example, blastocystis hominis, H. pylori, inflammatory bowel disease, all of these have been correlated with a higher risk of colorectal cancer. And if you can discover some modifiable risk factors doing a comprehensive stool test, perhaps you can prevent your incidence of cancer. And I would love to really think of gut health as a preventative for cancer, for autoimmune disease, for, A to Z. So many different conditions are associated with poor gut health. We know that there's an old saying that says all disease begins in the gut, right? And I do believe that the gut plays a really, really important role in our overall health.
Yeah. And for our listeners, just to understand the biological or physiological process that can take someone from IBS, IBD to being at a high risk for colorectal cancer, any inflammatory process in the body has the power to change how our cells function and the structure of our cells and the structure of the gut lining, which then in turn can lead to increased risk of developing cancers because it effectively just leads to cell malfunction, so to speak. So I really appreciate you nailing that point because nowadays with colorectal cancer, you don't even have to family history. It used to be that, especially if you have a family history or you're at that age, you're getting screened younger in life. But nowadays, we're seeing much younger people, even in their 30s, are starting to get screened. So gut health, that's 2026. We're all going to be working on our gut health and improving that. Okay, asking for a friend here. Many women struggle with digestion when traveling. It's like clockwork when we're at home, and then the second we board the plane and are staying at a different hotel besides our house, we struggle with bowel regularity. Are there any tricks up your sleeve, supplements or protocols that you recommend?
Definitely electrolytes. So you're going to become dehydrated when you're on that flight. And then you're also probably going to be stressed out a little bit.
Yeah.
Especially if you're the kind of person that's like, did I pack all my things? Do I have everything? Am I going to be
flying
late?
nowadays?
Yeah. It can be. It's like a very stress-inducing environment. And so magnesium, and I prefer the term magnesium, and I prefer the magnesium citrate version for people that tend to be constipated.
Yeah.
Because one, it's going to help you de-stress. And two, it's going to help you go number two.
Yeah. I sometimes will pack my son's magnesium citrate gummies and I'll eat them along the way, although he does get a little territorial around them because they taste so good.
Yeah. Yeah, I could see that. And also, like, if you can get Epsom salts delivered to your hotel room,
Yeah.
do an Epsom salt bath, and that'll generally even things out for you and get your magnesium levels up.
That's actually a really good point along the lines of Epsom salts. I actually will have food delivered to my hotel room because sometimes I struggle with snacks and what do I eat, especially when I'm traveling for work or conferences. And I do like to order Epsom salts along with some of my favorite snacks delivered straight to my room. Thank you for that tip. That's a great suggestion. What's your superpower besides writing best-selling books, which you're so good at? What would be your superpower?
Probably conflict resolution.
Wow. We may have to get your husband on the podcast for this. Tell me more.
Well, I used to work at a pharmacy that was super, super busy. I started working there when I was 16. And if you've ever been to a pharmacy, you might know that oftentimes there are a lot of sick people that are very grumpy that tend to go to
Yeah.
pharmacies. And let's just say the pharmacy I worked at was very, very busy and very understaffed at all times. So you can imagine there was a lot of conflict in that situation. And so I got to be really good at resolving conflict.
Yeah.
And it's come in handy throughout my life, really, really handy with pretty much every type of relationship. I feel like there is a way to express yourself and share your thoughts and feelings and resolve a situation, oftentimes without hurting the other person,
Yeah.
where it wasn't always a superpower. It was something that I definitely had to
You
that I
weren't
had to
born with it.
develop. Yeah.
Yeah. That is so beautifully well said. And I think, especially even in the medical field, we all have an opinion and we all have a professional, a personal, even experience in how we navigate healthcare in general. And people sometimes just get offended or easily triggered just because you don't share the same maybe opinion or strategy as them. And I think it's a really good reminder sometimes to pause and reflect and think about how you can be more kind in the delivery of the information and the message instead of looking for that jab, right?
Yeah, absolutely. Part of it, the conflict resolution, also, I feel like a part of that for me is I can always see another person's point of view. Sometimes it's a blessing, sometimes it's a curse, because I could be like, oh, yeah, I totally appreciate where you're coming from.
Yeah.
But I feel like overall it's a blessing.
Yeah. I love that. Thank you so much for sharing that. Is there a health trend that you absolutely love or that you're concerned about?
Gosh, kind of both. So I do love eating more protein. I think that's a really, really important intervention for women. And protein breaks down into amino acids and it's a building block for our
Right.
bodies.
Yeah.
So, so important. And I do eat a lot of protein. Yet, for people that have low stomach acid, this can be an issue. So, if they're eating too much
Yeah.
protein and they're not properly breaking it down, they're going to be basically not utilizing the amino acids and they're going to be fermenting that protein. And this could lead to issues with like ammonia and a lot of gut dysbiosis, right?
Yeah.
And so, for me, that's kind of like one of those health trends that I think is excellent, but also let's make sure we're not just doing that. And if we feel worse on it, let's think about that. What could be
Right.
causing us to feel worse? And oftentimes it could be low stomach acid.
Yeah, absolutely. And I see this even with GLP-1s. Like, I don't just put my patients on a GLP-1 without working on their gut health. And in fact, there are some contraindications. Like if someone is more prone to constipation, the last thing I'm going to do is put them on a GLP-1 until I get them more regular. And it's really funny because sometimes when I ask my patients how regular they are, they're like, I'm regular. And when I actually ask the number, they're like, every 3 days. I'm like, that's not regular, right? We want to make sure that we have optimal digestion. And I find that your book is also very helpful, especially for people who are on GLP-1, right? Because we want to make sure that we're addressing the gut health piece along the way. And I know that a lot of people who struggle with IBS and even IBD have benefited from GLP-1s. But if you're struggling with low stomach acid or already bowel irregularity, we want to make sure we fine-tune that first and not just prescribe a peptide that has a lot of benefits but could still do more harm. So, brilliant. We covered a lot today.
We did cover a lot. Do you want to ask me maybe about the craziest thing I did for my gut health?
Actually, that's fantastic. I would love to know what's the craziest thing that you did for your gut health.
I went to a colon hydrotherapist, and it was very, very awkward. I was so ashamed that I didn't even tell my husband that I was going. And I thought it was going to solve my digestive issues, but it actually worsened my diarrhea. And also, it was like the most awkward, uncomfortable situation that I've ever been in. So that was probably the craziest thing.
Wow, so you've not done a colonic since then?
First and last, baby.
Never again. On that topic, real quick, what are your thoughts about people doing coffee enemas?
To each his own.
Right?
To each his own.
Some people swear by them. Other people probably have the same experience as you with a colonic. Well,
I think I'd be more comfortable with that because with the colonic, it's like another person, like inserting a tube
right.
in your nether regions. And that was not comfortable.
No, not at all. There's so many other ways to improve gut health, right?
There are so many other ways to improve gut health.
Less invasive. Say that for the colonoscopy.
Yeah.
Well, Dr. Izabella, thank you so much for taking the time to be here. I know that many people will find this conversation extremely useful and valuable. And until next time.
Thank you for having me. It's just been such a pleasure to be here with you.
Thank you.